Dr. A, Mary Alice, welcome to The Art of Being Well.
Thank you so much for having us, Will. This is exciting.
Yeah, how did you two get together? I love you both together. You guys have a great duo, but how did it happen?
Well, I love to say it wasn't that long ago. It was less than a year ago. I was co-hosting Molly Sims's podcast, and I was bringing doctors that I wanted to interview because during the pandemic, I had been a fashion designer and had to shut my fashion line down because nobody was wearing cocktail red carpet dresses. And my parents got sick. And so I was really, perimenopause, everything's falling apart, needing to figure out, what's going on in life. And Molly said, hey, you're going to want to meet this doctor. She's coming on, and she brought Ozempic and Mounjaro to LA. That's just all she said. And I was like, well, Lord have mercy. I want to go hear about Ozempic and Mounjaro. So she walked in and starts talking about her breast cancer journey, how she diagnosed herself with her breast cancer, and started talking about PCOS, polycystic ovarian syndrome, and how she is the expert in how her mission in life is to make it a household name. 15% of all women have it, number one cause of infertility. And that is why she started using tirzepatide and Mounjaro and all these things. So I just said, oh my God, I left the podcast and I called her and I said, can I take you to lunch? Took her to lunch and I said, you are my why. You are my next frontier. If I can figure out how to put you into the ears and eyes and homes into every woman in America, that's my goal. So cut to
and my story is when I met her and she told me that, the first thing I told myself was, I've been waiting to bring awareness to women's health, but as a full-time physician working 100-hour weeks and nights, there's zero chance of doing anything outside of that. So she was like an angel in my life. She came in. I think she made my dream come true of forcing me to come in on podcasts, starting our own SheMD podcast, starting a company, Ovi, that has been my dream of more than 20 years to bring awareness to, basically bring awareness to this devastating condition that affects 15% of women and 75% of them are not diagnosed.
Yeah.
So,
oh my goodness. You're saying PCOS specifically, right?
Mm-hmm. Right. Well, most conditions in women's health are not diagnosed. I had a patient today from Monaco. And when I walked in, she just started crying. She's like, nobody listened. So this is not an American issue. It's a worldwide issue. She had to come from Europe to my office to get the diagnosis of PCOS because when they diagnosed her, they told her, well, there's nothing we can do about it. Go live your life. And that's how women get treated.
Yeah. Something we talk a lot about on the podcast is that phenomenon that you're talking about, this medical gaslighting that is mostly, I would say, is unintentional. It's just the system can't oftentimes hold these complex issues, and there's so much not known about it. It's not talked about. How would you describe that? I mean, do you this sort of concept of medical gaslighting that I see a lot with people with autoimmune problems and hormonal problems?
Part of it, obviously, it's lack of training, but the majority of it is lack of time. Physicians are burnt out. I wear this, I'm not advertising for them, but I got a gift, this Aura ring about a week ago. And it told me yesterday that my Sunday was very stressful because I was in the hospital delivering 2 patients. And it kept messaging, you have to bring your stress down. You have to bring your stress down. So this is the life of doctors. And, come Monday morning, we're exhausted already, and the day hasn't even started. And if you add insurance on it with lack of payment, when you're getting $80 to do a full consultation on a new patient, what happens is you start going through patients, you give them every 10, 15 minutes, you're switching. You really don't have time to listen. So it's not the fault of the doctor. It's the system is failing the physicians and the patients. So... I think patients need more time. The only reason I have this time is because I don't take insurance. If I took insurance, I wouldn't be able to sit for 45 minutes and do a PCOS and endometriosis counseling. I wouldn't be able to calculate someone's lifetime risk of breast cancer. I couldn't talk about genetic testing. So I have that luxury. And so my practice is not the typical practice. And that's why when people say we all need doctors like you, it hurts me because I know it's impossible with insurance companies.
Yeah.
It's impossible.
It's so true. I mean, I'm if you didn't know a little bit about my background, I'm in functional medicine, telehealth. Again, that's completely concierge. It's out of the model too. And that's what people tell me, like, well, why don't other doctors spend this amount of time with me? And it's exactly what you're saying. It's not a lack of caring. Even if they were trained in functional medicine or nutrition or whatever, they wouldn't have the time. So it's not an individual indictment on a doctor, like you're saying. It's a system issue. I mean, these are such complex issues, but like, have you, or either one of you, like, how do we fix this? I mean, we're just seeing patients from the ground up, but I mean, these are big questions and problems.
Well, I think we start by educating, in our case, women, in your case, men and women. I mean, your podcast is an educational platform. The SheMD podcast is an educational platform. The PCOS platform that we started, Ovi, is we have a calculator that you can go on and put your symptoms in and the likelihood that you have PCOS. So then we have a supplement that replaces, I'm not legally allowed to say that, but it replaces prescription medicine, and it works and it fixes. So it takes the onus off of having to find a doctor like Dr. Thaïs that understands PCOS. No, we're going to give you the information, the woman sitting at home or the mother or the daughter or whoever this is. And I think that that's the problem. I
just want to add that it doesn't replace prescription medication. Our supplement is just an amazing supplement we created to basically alleviate a lot of the symptoms of PCOS, from body composition to all the inflammation, regulating their blood sugar and their hormones. So we started this platform partly, and I wish we had this platform for all medical conditions, right? You come on this platform, let's use this platform as an example of a solution for patients. 75% of PCOS patients are not diagnosed. So what do? I basically have a questionnaire. Patients can go log in for free, answer the questions that I have, and based on their questions, we tell them, obviously we can't diagnose them online without seeing them, but we can tell them the likelihood of them having polycystic ovarian syndrome. And if they have a high likelihood of having PCOS, then we have provided a supplement that will help them really alleviate a lot of their symptoms at home if they don't have access to a doctor who's correctly diagnosing them or prescribing the medication. Because, I always say the problem is, you ask the question, what is the problem? First, it starts with education. You have to have patients be their own health advocate. In order to be your own health advocate, you need to have the education. So you, me, Mary Alice, what we're trying to do every single day is to empower women to get educated at home and to be their own self-advocate. But it doesn't end there, right? So you're a woman at home, and I'm saying painful periods are not normal. If you're doubled over, if you're missing school and work, you probably have endometriosis. That patient needs to have access to a doctor who actually takes the time to listen to her. And that doctor needs to be experienced enough to know how to treat that patient. Let's say that happens. Then the doctor writes a prescription, let's say for Orilissa or Myfembry, right? Which are endometriosis medications, let's say, that almost a lot of times don't get, patients have a hard time getting it approved. Then the patient has to be able to afford that treatment. I mean, look at how many levels, imagine a 25-year-old girl has to go through to get the treatment she deserves. There's so many limiting factors. So we're starting with the education because that we empower them to be their own health advocate, but we need to fix the medical system. We need to have doctors who listen. Telemedicine is going to change that. Robots are going to change that. People get angry when I say I look forward to robotic doctors. I need 5 robots that act like me and talk like me and practice like me. My daughters are at Stanford. I'm like, for God's sake, make a Dr. A robot in my office. I'm going to put all of them to work every day, and that will resolve it.
Only 5 doctors, Dr. A? I think
exactly. We need a few more than that.
I need 5 for my office, 1 in each room.
Well, I think it's also when I think of both of you as these amazing doctors, one thing that you both do that is rare, and it shouldn't be rare, is that you look at the whole patient. as a functional medicine doctor, that's what you do. You look at everything. It's not just a gut problem. It's a whole problem. It's not just a hormone problem. You do the same thing. You're a gynecologist, but every person that comes into your office, you're looking at the whole the whole picture. So I think that in the same way, and Dr. Cole, I know you're also so passionate about this, we have to fix the food that we eat, which is the very basis to our health. We have to start thinking differently about medicine and how to treat, rather than waiting until someone gets sick. We have to figure out how to treat them from the inside out. So
and the system, like we keep saying, like the system's not set up like that. I mean, there's just talked about very little in traditional medical training. So it does start with that. Most of my colleagues in functional medicine are conventionally trained, but they didn't learn any of this stuff in medical school. They had to postdoctorate training in functional medicine and clinical nutrition to get this. So it's a completely different model, right? It's a completely different focus. And it's sad, right? Like you said, Dr. A, we have to go outside of the system to actually get people healthy. And that's just the state of affairs right now, but we're doing the best we can from our own, side of things. You talked about PCOS. I'd like to double down on that, so maybe define that for people that don't know. I saw recent reports that one estimate said that about 7% of the United States is metabolically healthy. We know PCOS is insulin resistant in nature. There's an insulin resistant component to that.
I'm so proud of you. You're so knowledgeable about it.
Yeah, like I look at labs for a living, so I live and breathe this stuff. But for people that don't know, like what is PCOS?
And thank you for asking.
Yeah.
So polycystic ovarian syndrome, we call it PCOS, is a hormonal condition that affects 15% of women in their reproductive age, and it's one of the top causes of infertility. You do not need to have a blood test to diagnose it, but generally speaking, you need to meet 2 out of the 3 following criteria to know if you have PCOS. Number 1 is history of irregular cycles. Number 2 is PCOS looking ovaries on ultrasound. Now, polycystic doesn't mean you have a cyst. I have patients, they come, they're like, oh, well, I had a cyst before. That's not what I'm talking about. Polycystic ovaries are specific findings on ultrasound, which a trained radiologist or a physician can easily detect. We call it string of pearls. You have all of these follicles, and the ovaries are larger with multiple follicles. And it's a classic look to it on ultrasound. So that's criteria number 2. And criteria number 3 is either elevated testosterone symptoms or elevated testosterone in the blood. And I say or because you don't need to have a high testosterone in the blood. What are the symptoms of high testosterone? Facial hair and body hair are the most common. It could be male pattern hair thinning. It could be acne, body acne, facial acne. These patients, so that's how you diagnose. If you meet 2 out of the 3 criteria, then we can diagnose you with PCOS. PCOS patients tend to have mood disorder. They suffer from anxiety and depression. And they, like you talked about, a lot of them are insulin resistant. They usually have family history of an overweight family member or diabetes, prediabetes in their family. Because a lot of these patients, they struggle with their weight from a very young age, believe it or not, a lot of them have an eating disorder. I don't know if that eating disorder comes because of the weight gain, because of the acne, because of the facial hair, because they lose their self-confidence at a young age, or is it because they get dismissed in the medical system? These are young girls who eat the same thing as their friends. They do the same amount of activity, but they're gaining weight and their skinny friends stay skinny. So, and I don't blame them when they end up sticking their finger, because when you go through the system and people dismiss you and they tell you exercise more, eat less, at some point you get to a point that you're like, I cannot possibly eat less and I cannot possibly work out more. So that's not normal. And they feel defeated. And that's why they're so exhausted and they get anxious and they get depressed. And unfortunately, PCOS is one of the top causes of infertility. And, these patients have a lot of eggs. They go at age 35 to their gynecologist. They do an ultrasound on them and they're like, oh my God, Mrs. Smith, you're doing great. You have so many eggs. You're fine. What they don't understand is that PCOS egg quality actually declines rapidly after age 30. So these patients might have a lot of eggs, but the quality is not as good. So you do want these patients to freeze their eggs a little bit earlier in life. Usually I recommend my patients from 28 to 30 to freeze their eggs.
Got it.
And half of women with PCOS have endometriosis. I'm Dr. Mary Alice Haney, that I've learned so much from the woman sitting next to me. But 50% have endometriosis, so they have a lot of eggs, but then their eggs get destroyed, the eggs that they have. So it's just this. That's why it's kind of a double whammy.
Right, and with endometriosis and adenomyosis specifically, I see a lot of cases like this. There's obviously that autoimmune component too. We're seeing not just with these female hormone-related autoimmune issues, but a rise of autoimmune conditions across the board. Like for both of your experience in the podcast and immersing yourself in this, what are the top drivers? Why do you think we're seeing this increased rate of autoimmune problems?
It has to be our food.
I think
it has to be stress. Someone asked me today, in the past month and a half, I've delivered 10 growth-restricted babies, 10. And to a point that the high-risk obstetrician who does the ultrasounds called me and said, what is going on?
Yeah.
And why are all these babies not growing? Why are we delivering all these 4.5, 5-pound babies? And the only explanation I have for it is stress. Everyone's stressed out. Everyone's anxious. Our food, my patients luckily have the means to eat more healthier food, plant-based foods, organic foods, which is not something common for the rest of the population. And but if you ask me, I would say stress.
Well, and it's not just autoimmune, it's cancer. The rate of cancer. We had a podcast the other day, and I was the only one of the 4 women sitting there that had not had breast cancer. Wow. That's shocking. And it's just, it shocks you, What
do you think?
Well, I think it's a confluence of factors. I've seen studies where it's about, depending on the autoimmune condition that you're looking at, it's about 77 to 91% of these factors are epigenetic, like you're saying. Like genetics plays a role with autoimmunity specifically, and then certainly with insulin resistance, right? But the majority of our genetics haven't changed in like 10,000 years. So that doesn't explain, genetics alone does not explain the dramatic rise of these either autoimmune or metabolic or these other, inflammatory problems like cancer. It's this, what I've seen, the most compelling research I've seen talks about this epigenetic genetic mismatch, like just exactly what you guys are saying, this sort of chasm that our genes are living in a brave new world, that there's environmental toxins, there's food, the impact of the soil microbiome, chronic stress, unresolved trauma. It's like something's got to give, and we've hit this sort of tipping point where the cup's overflowing and our genes can only handle so much stress, and our modern life is like a proverbial stress test on the human genome and the human microbiome. So I think it's not one thing, but it's multifaceted, but it's certainly all of these things.
One thing that could be related or unrelated, I don't know if you know this, but my 4th daughter is adopted from foster care. I delivered her to a heroin addict who used heroin and meth every 2 hours during her pregnancy, a lot of trauma. And when it's a long story, but I ended up fostering her, and I took her to a neurologist when she was 3 months old. And the neurologist pulled me out of the room and said, walk away from this child. I had 3 other older daughters at home at that point. And I'm like, why? She's like, well, this child has been exposed to so much drugs. She's not going to be able to walk in time, talk in time. She's going to be autistic. She's going to have severe developmental delays. And I was like, well, how did you figure all that out from this exam? And she looked at me and said, she's 12 weeks and her behavior is the behavior of a 6-week-old. And my daughter looked at her and she said, but that's only 6 weeks of discrepancy. She can catch up. She looked at us and said, no, that's half of her life that she's behind. And I looked at her and I said, what about nature over nurture? What about nurture? She said, no, it's 90. This is a neurologist at a very well-known institution who told me 99% is nature and 1% is nurture. When she said that, I grabbed my daughter and I walked out. And fast forward 4 years, she walked at age 1. She talked at age 1. She is the happiest child. Mary Alice has seen her.
She's a tornado.
She swims like no one. She flips into the water, double flips under the water. And her teacher 2 weeks ago said she's her favorite student. She's the most positive, happy student, and she's a leader, and all the other kids follow her. The reason I'm saying this is because we tend to label patients very early, right? In life, they get labeled, and we don't give a chance to people to live their best life. And had my daughter not been in our household and had gone back to that traumatic upbringing, she would have been autistic. She would have been delayed. She would have had all the things that she listed when we visited them. Why am I saying this? To do a full circle? It's our environment makes a huge difference.
Yeah.
Huge difference. You can start with love, hugging someone every day, lowering their stress, making people feel loved and needed and protected, eating healthy food, lowering that stress, all of it. It's a combination of everything that I feel like, unfortunately, we're losing all of it one by one.
Yeah. Well, yeah, it's absolutely true. So for people that are struggling maybe with some of these symptoms, PCOS symptoms, female hormone symptoms, endometriosis, let's start with food. But for both of you, what are your top foods that people should be eating to be supportive of hormonal health?
I think you can answer that question for us, but I would say non-inflammatory foods.
Right.
Endometriosis is very associated with a lot of inflammation. Endometriosis patients, 85% of them, when undiagnosed and untreated, end up having SIBO, which is small intestinal bacterial overgrowth, which is leaky gut. Leaky gut can make you insulin resistant. So they're all connected. PCOS patients have a chronic low level of inflammation. For that reason, we have our OV supplement is actually part of the supplement is all anti-inflammatory supplements. So I would say any anti-inflammatory diet, more plant-based, less of the animal products.
Less refined sugar, like try to cut the sugar, all the things that just inflame you.
Processed foods, packaged foods. But, we say this. We had a podcast with Tiffany Haddish, and who helps a lot of these foster kids. And she said these foster families, right? She's like, they don't even have access to like the most basic fruits and vegetables.
Right.
Like
the food deserts. They're
totally food
urban
deserts.
Food deserts, yeah.
And it's just, so we have to fix that. I guess, and I know, well, Dr. Cole, you're really involved in that too. If we don't fix the basic needs of our American children, their lunches that they're getting in these schools are processed. The whole thing is processed. I mean, sometimes it's their only meal. So it's just that if of course we're going to see a rise in cancer. Of course we're going to see a rise in autoimmune. Like if you can't even feed your children good, nourishing food, I mean, that's the problem. That's the first problem I think we have to tackle as an American culture.
Yeah. I was at the rally at the Kellogg's headquarters in Michigan a few weeks ago, or a month ago or so ago. And people online that were in the health, wellness, the functional medicine world were like, well, why, the ones that didn't get it would say like, well, why are you even advocating for them to remove artificial dyes in their cereals? Because those things are not, it just for people that don't know, like those artificial dyes and some of the preservatives are not used in the same cereals in other countries like Canada, the UK, and across Europe, Australia. Well, their critique of it, well, they'd be like, well, why just don't eat Fruit Loops? Like, what's the problem? You wouldn't eat Fruit Loops anyways, Dr. Cole, even if they weren't artificial dyes in it. That is true. But as you're saying, there's a lot of people in Middle America or around the country in food deserts. They're not health aficionados, and the food system stacked against them. Yeah. And that's kind of what you're talking about, right?
And, as an immigrant, I was 17 when I moved to this country, and I grew up in Iran. And I'm completely being honest. The first thing that caught I was 17 when I came here. The first thing that I noticed for the first time in my life, I saw an obese patient. I had never seen an obese patient in my life, growing up 17 years in Iran. So that was new to me. And a lot of people who migrate from other countries notice that. But it's become the norm for us in this country. And now it's that's who I treat, right?
Yeah.
And a lot of times when we let go of our diet, it pushes us into an insulin resistant scenario. They can start this cascade of PCOS and all these symptoms that come with it.
Yeah.
So and that's why, in 2014, I started prescribing Trulicity for weight loss, which is a type of GLP-1. And I think these medications at least have revolutionized and helped a lot of our obese patients in this country. And I'm so grateful for it. And I get so sad when people have negative comments, because underweight people are using it to lose more weight. But that's not the indication for these medications. And in the right hands, treating the right patient, it's been a game changer, really.
Yeah. It's funny that you said that. Well, not funny, but you know what I'm saying. It's interesting, fascinating that you said that about coming in to this country and being in Iran for so many years. I was in Paris recently. It was my first time in France. And a true American, I go all the way to France, and I take my daughter and my wife to Disneyland Paris, because if Anaheim and Orlando wasn't enough, we had to go to Paris and do
something I would do.
I had fun. There's no shame. I did all the cultural and historical stuff too.
Yeah.
But we had to stop at Disneyland Paris. And something that my wife and I noted was this stark difference between Anaheim, Orlando, like Disney, versus Paris, is that there were next to no wheelchairs, adults in wheelchairs. Everyone was walking, and even there were next to no strollers. Like, even the kids are walking, and of course they should be walking. They're kids.
Yeah.
And not that there weren't any. And I just think you look at the level of people that just can't even walk all day long, let alone a few hours at a park in the United States. The sea of wheelchairs in Disney is shocking in the States. And then I think all the way down to being a little baby, we train our kids just to sit and don't walk and be pampered all day long and live this sedentary lifestyle. That has to be. It was shocking for me as an American to see it differently.
Well, and think about that. Every time I go to Italy or France, I eat pasta, I eat bread. I'm walking everywhere. I come back, I've lost weight. I'm like, how is this even possible? It's just it's a diet full of cheese, wine, and bread. And I come home and I'm like, this is crazy. But you're walking everywhere. The food is pure. And I don't think there has ever been an expert on this podcast that we have had who has not said the number one treatment for whatever it is, brain health, autoimmune, PCOS, is exercise. I mean, it is literally like something that everyone can do. It's free. And yet we still have a society that's so sedentary. So
Yeah. So I'm interested to know, because you guys have had some fascinating guests. Like, both of you have so far, I know, the podcast is relatively new, but so far, who's been your favorite guest? I won't tell them. No one will.
Oh, my Lord, that's like picking your children.
I will tell you. I love, first of all, we brought a lot of celebrity patients of mine, and they all volunteered to come and share their medical condition just to bring awareness to that condition. Toni Braxton talked about lupus. Kim Kardashian talked about psoriasis. Khloe Kardashian talked about surrogacy.
Florence Pugh, PCOS.
Sophia Ricci, PCOS. But I will tell you, the one that broke my heart was a patient of mine by the name of Phoebe, who was on our podcast a couple of weeks ago. And she struggled with an eating disorder since she was 14. And at 19, I diagnosed her with PCOS, and she started shaking in my chair when I diagnosed her, because she said for the first time in her life, she felt validated and not crazy, because everyone made her crazy. And she told us the story how she, in one of the treatment centers, they would have her eat an oily, unhealthy pizza for lunch. And she kept telling them, I can eat this, but I will get sick eating this because I don't feel well when I eat this, because she has insulin resistance. And they told her, see, you have an eating disorder. That was such an emotional, passionate.
She and her mom were both on it, and they both just, that episode. We both said, she just started bawling, crying, and just said, I'm so proud of myself. I fought for myself. I fought when everyone was telling me that I'm crazy and that I'm this and I'm this. And, her mom fought for her. So that was just really.
I mean, imagine being a 14-year-old with PCOS and ending up in a psychiatric unit when your PCOS is getting dismissed. Put yourself in the shoes of that child and her mother. And so if I had to pick one episode, I would pick that, because my heart breaks for all these young girls with eating disorders who, I'm not saying all eating disorder patients have PCOS, but I will tell you a lot of them have an underlying PCOS condition. And for that reason, that was my favorite podcast.
I think mine is probably our Olivia Munn podcast, because Dr. A saved her life.
I saw that with breast cancer.
Yes,
right?
for breast cancer. And I think for me, Olivia really started a revolution in this country. And, so many women now know what their lifetime risk of breast cancer was. And just to have her being so open and vulnerable about, about that. So to me, I think I love the Phoebe episode too, but we're so blessed that these incredible,
all of them. It's hard to pick between your children.
Yeah, but these incredible women with these huge platforms come on and talk about such personal things. These celebrities that don't talk about anything personal come on and just open up their heart, and all for the purpose of what you do in your podcast too. It's just to teach women and women that don't have access to the kind of medical care that Dr. A and that you provide, like when they leave it, they're educated. When they leave these, they know what to do, and whether it's the celebrity and the expert, if Dr. A isn't the expert. So I don't know. I just feel like, there is a lot of, oh God, what are we going to do? What are we going to do? But there is a lot of hope. And I think, the rally that you went to, that's hopeful. Your podcast is hopeful. SheMD podcast is hopeful. Like, we're trying to change the system in the way that we can. And I think it's going to make a difference.
Yeah.
And honestly, take the load off of some of these physicians who really don't have time. They appreciate when their patients come in educated on a topic that they think for example, if you're educated about endometriosis and you're empowered and you go to your doctor, I promise you your doctor will appreciate it. If you go to your doctor and know your lifetime risk of breast cancer and ask for your mammogram and ultrasound and MRI and genetic testing, your doctor will. We appreciate patients like that.
Yeah. And my word of advice for an empowered, informed patient is always to come in with kindness, because sometimes people come up with their dukes up, like they want to tell the doctor, and they end up this sort of ego war, and that's not going to be good too. So
that's true. That is true.
Be informed but kind. Informed but still
they are.
Respectful, right? What I was thinking about was going back to the Olivia Munn story. What happened there? Like, what should people know about early detection and breast cancer?
Olivia Munn she was young, healthy. She had just delivered her baby. She had family history of breast cancer. But I think if I'm not mistaken, an aunt or a grandmother older. I don't have her chart in front of me right now, but she went for her mammogram and ultrasound, and it was negative. And she came to my office, and I said, Olivia, because I had met her during her pregnancy, so I couldn't really do any breast imaging. She came back, and I said, I know your mammogram and ultrasound's negative, but your lifetime risk of breast cancer is pretty high. So for that reason, I need to send you for your MRI. For a breast MRI. And I remember she called me back. She's like, my doctor friends are saying, why is your doctor so aggressive? Why is your doctor so paranoid? You've already had your mammogram negative, ultrasound was negative. So for my patients or people who know me, I never change my plan. I don't care. I always say, if God comes from the sky, I'm not going to change my plan. You have to go do your MRI if you want to stay as my patient. So she went and did her MRI, and of course they found few lesions on her breast, and they biopsied it. All those lesions were cancerous. And then I sent her very aggressive form of cancer. And then they re-reviewed her MRI, and they found another lesion on the opposite breast. Biopsied that came back abnormal too. So, she just came to my office one day I said, this is the situation. You have breast cancer. It's aggressive, but it's very, very early. We're lucky. And she said, well, what do you think I should do? I said, well, I'll tell you what I would do. And I would do a double mastectomy. There's just too much disease everywhere. And, you're so young, you just delivered a little baby. And she's so lovely. For all the people who know her, this woman is so kind and so loving. And so she did it. She was very emotional. It's very hard for a woman to decide to do a double mastectomy. But when that decision becomes easier when you have little children at home. So she did it. And I think we talked about her story. And every time she would come to my office, I'm like, Olivia, can you please share this with the world? Because you're going to change so many women's life. The same thing happened to me, but I'm a physician and I don't have a voice, I can only, my voice goes as far as my friends and my patients, and it stops there. And one day she called me and she said, I'm ready to share. I think I cried when she called me and told me that because I knew the power that her story would have on saving so millions and millions of lives. And she did it. And I will forever be grateful. The day, Mary Alice and I were at the InStyle magazine when they honored her and she went on stage. When they called her on stage, I could not stop crying.
Yeah.
I know.
So, yeah.
But
It's
she gets emotional every time. And I think, Olivia says it's, what does she say? It's the worst club with the best members. These warriors, these women warriors that have, fought. And you too, you're a part of this, Dr. A. I mean, you did change the world, and that her announcing that. And we always say we have these little God kisses that come around, like since we started this podcast. Like this person says they'll be on it, and she decided that she was going to do it right when this thing. So I just think it's just, when your why really is to help everybody and to change the world for the better. I think that it's always,
But I think when she was getting her award and people were clapping, the first thing I told myself is these people have no idea what this woman just did for the world. They sit here, they clap, and they honor her. But the power and what she did for all women around the world was just nothing I've ever experienced at a personal level. And, she brought awareness to this lifetime risk calculator, which is the Thaïs. It's free. We have it on SheMD. People can go calculate their lifetime risk of breast cancer. And the importance of that, if you have time, I just want to quickly review that for your female audience who are listening. It's just like your full name, your date of birth, and your phone number, you should know your lifetime risk of breast cancer as a woman. And the Thaïs formula asks you a few questions about your history, your height, weight, age at first menses, age, you had your first child, density of your breast. So the questions they're very straightforward, family history. And it tells you a percentage. Your likelihood of having breast cancer within 10 years and over your lifetime. If you take that lifetime risk score, it can really help you guide as to when to start your breast imaging. A lifetime risk of 20% and higher is considered high risk. An average American has a 12.5% chance of getting breast cancer. So you have a 1 out of 8 women in America will get breast cancer, which is a really high number. And I always use the plane example. If I told you have a 12.5% chance of boarding a plane that would crash, most of us would not board it. But when we talk about breast cancer, people dismiss it. 85% of patients who get breast cancer don't have family history of it. So don't tell me you don't have a family member with breast cancer. It doesn't matter. You need to know your lifetime risk. My lifetime risk was 37%. I had no family history. I had no gene mutation. I never smoked, never did drugs, don't drink alcohol. I've never been overweight, and I was not on hormones. I was not supposed to have breast cancer, but I did. But that lifetime risk is important. If your lifetime risk is less than 15%, your average risk, you start your breast imaging at 40. And if you have dense breast, you add an ultrasound to it. If your lifetime risk is between 15 to 20, you fall into the intermediate category. You can start your breast cancer screening with mammogram as early as maybe 35 or 10 years before your first family member was diagnosed. And if you have dense breasts, you add an ultrasound to it. But if your lifetime risk is 20% and above, you can start your breast imaging as early as 30. And you start with mammogram and ultrasound, and you can alternate it with a breast MRI. Mammograms pick up 80% of breast cancers. They miss 20%. So by adding an MRI to it, we can diagnose some cancers that are sometimes missed on mammogram.
Thank you
for patients who have very high lifetime risk of breast cancer, meaning 35, 40, then they have the option of doing a prophylactic double mastectomy where you remove the breast tissue, which is what I did, and or they have the option of taking a medication, estrogen blockers, for about 5 years, and they can reduce that risk by about 50%.
Got it. Amazing information. Thank you. What's your thought, Dr. A, on thermography, sort of these alternative screening options?
So thermography works if you have a big lesion in your breast that lights up. Thermography is not there to replace a mammogram.
Yeah.
It's not there to replace an ultrasound for dense breasts, and definitely not there to replace an MRI for high-risk patients.
Got it. Some patients will often tell me, and again, I say the same thing as you. It's not, these things are not replacements for a mammogram. But what do you think of the whole body MRIs out there, like Prenovo and other, screenings for different types of cancers?
Listen, I think if you have the means to do a whole body MRI, again, if there's a big tumor, it can detect it. But for example, you can't do a whole body MRI and say, I don't need a breast MRI. A whole body MRI does not replace a breast MRI. A whole body MRI does not replace colonoscopy. So if you suspect anything, if you have if you have multiple cancers in your family, more important than doing a full body MRI is do your genetic test if you have family history of cancer. Genetic tests right now, they're $249 if not covered by insurance. 90% of them are covered by insurance. I do the MyRisk genetic test in my office. Number 2, if something doesn't feel right, don't ignore it. Don't ignore chronic pain. Don't ignore chronic bleeding. Don't ignore symptoms that are not normal. Go make an appointment. If you feel like your doctor's not listening, get a second opinion, get a third opinion. The Prenovo scan has found a lot of tumors in a lot of patients. So if you can afford it, it's expensive. I don't want to advertise for them because not everyone can afford it. And a lot of times if we feel like there's something that needs to be done, we can order an MRI and it can get covered through the insurance.
Yeah.
So
you mentioned Kim Kardashian and her psoriasis journey. What was that like? What worked for her when it came to her psoriasis?
I mean, we brought Dr. Wallace, who's a rheumatologist who was her treating physician. And I love Kim because she's talked about her psoriasis for years, and she does show her lesions on her show and on her Instagram. And I really love that about her. And we just brought Dr. Wallace. I think over the years she's made, I don't remember her treatment exactly, but she's been on multiple medications. But they just talked about different options for treatment, the newer options, and how when you have one autoimmune disease, there's a 30% likelihood of having another autoimmune disease. So,
and genetically, most likely one of your children will. So it's just, that's again the genetics of it all. But we try to bring the biggest medical experts in their fields along with the celebrity. I mean, obviously with PCOS and endometriosis, Thaïs is the expert. So that's always what we do there. But Dr. Wallace has been on twice. Because
by the way, they're better. There are a lot of good experts on PCOS. I would love to invite them. Where are you going to meet them?
There are. I happen to love this one sitting right next to me.
As you both know, the podcast, it's called The Art of Being Well. At the end of every episode, we have Your Art of Being Well. So I'm going to just throw out random questions, what comes to my mind, and you're never going to know what I'm going to say.
I love it.
I want to learn about your art of being well. You both can answer these questions just one at a time. The first question is, what is the worst tasting healthy food that you eat? It tastes freaking disgusting, but it has amazing health benefits behind it.
Ooh, that's a good one.
I don't like disgusting, so I usually don't put anything disgusting in my mouth.
I know, me too. I'm trying to think.
Like nothing, maybe like, okay, maybe it's something disgusting, but maybe it's like you're not doing it for the taste, you're doing it for the health science behind it.
I would say some of the green juices that my husband makes me drink in the morning.
I would definitely say that. I try to get my kids to drink the green juices in the morning, and they're like, "This is disgusting," and I actually love them. But I'm sure that's probably for me too. That's something that it's more about what I'm getting rather than the taste of it.
Yeah. Do you have any like non-food, non-supplement like biohacks or wellness practices that are just non-negotiables for you?
I get a lot of massages, and I watch television the entire time that I'm on the massage table because that's how I turn my brain off. I think
you're getting a massage therapist to the house, and then you're just watching TV while they're massaging.
I'm watching TV the entire time.
You're a step ahead of me because I'm getting a massage and I'm answering text messages with my patient.
She's terrible. She doesn't take very good care of herself. We're working on that. But in terms of biohacking, I've tried everything. I mean, I definitely have been somebody that's tried NAD supplements, that tried peptides, have tried, intermittent fasting. I'm somebody that likes to try it all. I think at the end of the day, hot yoga is probably the best biohack for me that I found.
I love
works.
For me, it goes way down. I would say sleep, because my basic needs are not met during the day, and my human rights are not met. I don't eat in time. I don't always eat healthy. I sometimes skip meals. I definitely don't sleep well. Some
Dr.
nights
we need to talk. We
gotta. I mean, Dr. Cole, you have no idea. Her cortisol levels are so high because she delivers these babies in the middle of the night. I mean, it's crazy.
And I told a patient of mine yesterday that I didn't want to do as many deliveries anymore, and she started crying. She's like, "Well, you promised." And I came home and I told my husband, I'm like, I can never, like, there's no way out. The way she cried, I would never not deliver her. Do you know what I'm saying? Like, it's just, but I think all physicians, I can't say all physicians, but definitely OBGYNs.
Yeah, right. It's the nature of the job.
It's tough.
Yeah. Our top patient base are mostly people in the conventional model because of that. I mean, nurses are a top patient base, actually.
I bet.
Yeah, because it's just constant, right? And same with you, right? And
so I need help. I need to be your patient.
Let's do it. We'll help you out for sure. Probably we'll start with you taking less patients for a time, but maybe not. Maybe we'll help you. We'll heal despite the crazy schedule.
My problem is I love what I do. I love my patients, so I don't feel tired when I'm at work. I only feel exhausted when I go to bed. That's when I feel the pressure and the stress. But when I'm at work, I love being surrounded. It's where where I feel best.
Right. What's your fate for both of you? What's some place that you've traveled to? We're thinking holiday, self-care, right? We're relaxing. Where's somewhere that you traveled to that is like an unsung place? Not enough people know about it. People should travel if they have a chance.
Can I go first?
You can.
Yeah, go for it.
So at the peak of COVID, because during COVID I worked so hard, I was exhausted. Comes the holiday season around Christmas, I looked at my husband, I'm like, let's go somewhere. And the only country that was open was Sweden. So we booked a flight with our children. We went to Sweden. We went to Stockholm. The hotels were empty. So they would give us these, like for one room, they would give us this giant suite because the whole entire hotel was empty. So from there, we took a flight to Kiruna, which is north of Sweden. In the northern part. And from there was an ice hotel. We toured the ice hotel. And from there, by the way, I just want to mention that the entire time we were in our ski outfits, even in Stockholm, because it's so cold coming from California. Right. So from there, we drove 1.5 hours north to Nabisco tourist station. They called it the Blue Hole. It's the best place on earth to see the Northern Lights.
Wow.
Amazing.
So we went to this place and it was like camping. You had to rent your sheets and your blankets. And of course, we rented every blanket they had. They would ring a bell every time the Northern Lights would come, and we would all go out. And it was the most magical trip. We did sledding with huskies. It was the surface of another planet for me. And it was so exciting, so beautiful. When we came back to Stockholm, I went to all these Swedish people. I'm like, have you seen the Northern Lights? They're like, no. And we grew up here. I'm like, how do you not fly an hour away? It's right there. We come from across the world to see it.
Isn't that the case for so many things? We don't appreciate what we have when it's
I
our
know.
home.
But it's the most magical place. And there were a lot of people, because I guess people think if you conceive a child under the Northern Lights, it'll be a lucky child. So there were a lot of newlywed couples there, and my family with the children.
Oh, I love that. I love that.
I didn't know that. All the lucky babies out there.
So I would highly recommend it.
That's amazing. Thanks, Dr. A. How about you, Mary Alice?
I would say Japan. I went to Japan for Christmas last year, and I have a blended family, and so every other Christmas we don't have the kids, and I'm always so sad when I don't have the kids. So we try to do something totally out of the, so it doesn't feel like Christmas, so I don't feel sad. So we went to Japan and we went skiing in Japan, and it was just magic. It just, I don't know.
It's amazing.
And the whole culture of Japan is so magnificent, and the people, and so I loved it.
Wonderful. What's a book that both of you have read? It could be fiction or nonfiction. I'm putting together a running list for the Art of Being Well book club.
Well, you have to send it to me because I love to read.
I would say Untethered Soul.
I love that book. There's a horse on the front, right?
Yep.
Beautiful. Yeah, it's a great book. Yeah. How about you, Mary Alice?
I read so much. I read everything. Lately, well, actually, there was a book called Horse that I just read recently that was really beautifully written. I love biographies. I just read the Lou Wasserman biography. He's a big guy that was like the original guy in Hollywood. I love Katharine Graham's biography. So I love origin stories, how people got, people that have done amazing things in life and how they got to where they ended up. So I think that those are good ones.
And I want to add, as a mother of 4 daughters, I would say if you have a teenage daughter between ages of 10 and 18, definitely read Untangled.
Okay.
It'll change your life as a parent of a teenage daughter. It'll
I
make
have
you
a
better
teenage
parent.
daughter. I need to read that. Untangled.
When my kids went to our church, to an all-girls school, before they started, they handed this book out and they said, you have to, every single parent needs to read this book before the start of school. And that book changed my life.
Wow, I need to get on that. Thank you both. Where do people go to learn about your amazing work, both of you? Where do they go, and where do they go to listen to the podcast?
Well, the podcast is everywhere you get your podcast. We shoot it also like a talk show, so we do it very visual. So you can go to YouTube, it's SheMD Podcast, or wherever you listen to your podcast. And like Thaïs said, on our website, it was really important to us that we have the risk calculators on there. There's videos that show you what to do with your score to help you figure all of those things out. And then our new platform that we just launched 3 weeks ago, I can't believe that. I don't know when this is going to air, but it's called ovii.com. There's a risk assessment for PCOS, again, free of charge. You can go on. And then our supplement was created by Dr. A and these incredible scientists who we really think it's going to change the world for people with PCOS and insulin resistance specifically. Yeah. We created it for PCOS, but anyone with insulin resistance can benefit.
Thank you both for coming on.
You're the best. This was so fun. Thank you for having us.
Thank you.